Welcome to the PARS Health TV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about the ACL knee injury treatment option. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. If you're involved in a sport such as basketball, football, or soccer, you probably know someone who has had an anterior ligament, ACL, injury. An ACL injury can bring an active life to a halt, whether you're a young athlete who plays a high-impact sport, or a middle-aged weekend warrior hitting the tennis court without a warm-up after sitting at a desk all week. ACL injuries can happen when you're playing a sport and you collide with another player. They can happen when you stop or change direction suddenly, land improperly, or slow down while you are running. From the internal damage within the knee joint to the psychological stress of time spent away from sporting activities, the effects of an ACL injury can be devastating. People who play soccer, football, tennis, basketball, or volleyball, or who do gymnastics are more likely to twist their knees by mistake when they compete than, say, cross-country runners, who simply move forward at a steady pace. Your speed, combined with the way that you twist or turn your knee, makes it likely that you'll stretch or tear your ACL. ACL injuries are more common among women than men. What is the ACL? The knee's bone structure is made up of three parts: the femur, the tibia, and the patella. The ACL is one of the ligaments that forms across, connecting the tibia to the femur, and keeping the knee stable during quick changes of direction. This stability is important for cutting and pivoting activities in such sports as soccer and basketball. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. What are the symptoms? Many people hear a popping noise in their knees when they get hurt. But it doesn't happen to everyone. More common symptoms include pain. If you have a minor injury, you may not feel pain. You may feel sore along your knee's joint line. Some people have trouble standing or putting pressure on the hurt leg. Swelling. This is most likely to happen during the first 24 hours. You can reduce swelling by putting ice on your knee, and elevating, raising, your leg by propping it up on a pillow. Trouble walking. If you're able to put pressure on your hurt leg, you may notice that it's harder than normal to walk. Some people find that the knee joint feels looser than it should. Less range of motion. After you damage your ACL, likely, you won't be able to bend and flex your knee like you normally would. Diagnosis. During the physical exam, your doctor will check your knee for swelling and tenderness, comparing your injured knee to your uninjured knee. He or she may also move your knee into a variety of positions to assess the range of motion and overall function of the joint. Often the diagnosis can be made based on the physical exam alone, but you may need tests to rule out other causes and to determine the severity of the injury. These tests may include X-rays. X-rays may be needed to rule out a bone fracture. However, X-rays don't show soft tissues, such as ligaments and tendons. Magnetic resonance imaging, MRI. An MRI uses radio waves and a strong magnetic field to create images of both hard and soft tissues in your body. An MRI can show the extent of an ACL injury, and signs of damage to other tissues in the knee, including the cartilage. Ultrasound. Using sound waves to visualize internal structures, ultrasound may be used to check for injuries in the ligaments, tendons, and muscles of the knee. Treatment. Prompt first aid care can reduce pain and swell immediately after an injury to your knee. Follow the RICE model of self-care at home. Rest. General rest is necessary for healing and limits weight bearing on your knee. Ice. When you're awake, try to ice your knee at least every 2 hours for 20 minutes at a time. Compression. Wrap an elastic bandage or compression wrap around your knee. Elevation. Lie down with your knee propped up on pillows. Rehabilitation. Medical treatment for an ACL injury begins with several weeks of rehabilitative therapy. A physical therapist will teach you exercises that you will perform either with continued supervision or at home. You may also wear a brace to stabilize your knee and use crutches for a while to avoid putting weight on your knee. The goal of rehabilitation is to reduce pain and swelling, restore your knee's full range of motion, and strengthen muscles. This course of physical therapy may successfully treat an ACL injury for individuals who are relatively inactive, engage in moderate exercise and recreational activities, or play sports that put less stress on the knees. Painful and can make it hard to walk or put pressure on the injured leg. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.